I'm going to be responding to the claim of physician-assisted suicide allows for potentially for a competent terminally ill patient to eliminate unnecessary pain and suffering. And I will touch on the opponent's secondary claims of physician-assisted suicide is always at the request of the patient, and the right to life implies the right to death. First of all, I would like to state that that my opponent did not really phrase this as a claim of fact, but rather as a statement. There is no controversy to it, and there are problems with his evidence challenge. So even if his claim is true, it is not possible at this time. First of all, for evidence for his first claim of it's always at the request of the patient, he provides, physicians have an obligation to relieve pain and suffering and to promote the dignity of a dying patient. Patients would like to prohibit being a burden to others. He does not take into fact that there is professional integrity involved. All doctors are required to take a Hippocratic oath, which states, I will not administer poison to anyone where asked, and be of benefit or at least do no harm. So this means that if they cannot do anything to fix the illness, they should not attempt to do anything that may cause harm, which in this case would imply death. There is potential for abuse, which will be addressed later. And in his first example, he uses a comatose patient, which does not fit into the category of physician-assisted suicide, as this comatose patient would not be able to make the choice herself, and a third party would have to be involved. There's reasoning challenges. Pain and suffering are value-based. It varies person to person, and you cannot address it yourself, or you cannot measure it. There's a passive and active distinction between letting die and actively killing someone. The treatment refusal or withholding treatment equates to letting die, which is passive and is justifiable, whereas physician-assisted suicide equates to killing, which is active and not justifiable. The evidence, there is potential for abuse, as I touched on earlier. Certain groups of people lacking access to care and support may be pushed to assisted death, which therefore may become a cost containment strategy, which may include using the suicide as a way to receive money for insurance. Physicians are also liable for this if they make a misdiagnosis. In his second claim, where the right to life implies the right to death, nowhere in the Constitution does it state, or he uses this evidence that nowhere in the Constitution does it state or imply that the government has the right to keep a person from committing suicide. It is imperative that the competent, terminally ill patient choose to where and when they die. There is a reasoning challenge to this. The Constitution does declare that murder is wrong, and what is considered competent is not clear, as it can be misdiagnosed as well. There is a survey of individual physicians that show that half believe that PAS is ethically justifiable in certain cases. However, the professional organizations such as the American Medical Association have generally argued against PAS on the grounds that it undermines the integrity of the profession. Surveys of physicians in practice show that 1 in 5 will receive requests for PAS in a lifetime in their career. Somewhere between 5 to 20% of those requests are eventually honored. There are a few counterclaims to the right to life implies the right to death. There is the sanctity of life. Many religions and secular traditions are against taking a human life, and assisted suicide is morally wrong because it contradicts these beliefs. And the fallibility of the profession is that physicians may make mistakes. For instance, there may be uncertainty in diagnosis or prognosis, and there may be errors in diagnosis in the treatment of depression or inadequate search for the treatment of pain, which, again, it stops the, it questions whether the patient is competent or not. And
All right, the claims are labeled pretty clearly, so there's no problem there. You kind of make an argument that there's not really a proposition, that it's really a statement, and you can't tell what the controversy is. I'm not sure I follow what your point there is, and I'm not sure that I agree, since you found plenty of things to talk about that kind of undermines that claim to begin with. A signpost on the first point is fine. The context that you elaborate on, that's probably a good idea. You do make an assumption that everybody who becomes a doctor takes the Hippocratic Oath, and that the Hippocratic Oath is an appropriate criteria for people to follow in this situation. I don't know that either of those things is automatically true. And in fact, since there is a difference of opinion in the medical organizations versus what the doctors sometimes think, there may be some variation there. You're getting into the value arguments there, and so that's taken us a little bit off track. I did think you had a good argument about the comatose patient because they don't fit into the category there, and that's pretty responsive. Then you kind of get sidetracked onto some other issues like passive and active euthanasia, and I'm not exactly sure how any of that advances your claim on this point. The potential for abuse, I think, is a good counterclaim on this issue, but it seems to be mostly hypothetical in these circumstances, and any evidence that shows that such abuses occur or they occur more frequently in places where they allow euthanasia would have been helpful there. Your transition to the second point is also very clear. You make a reference to murder being in the Constitution. I'd have to double check that, but I don't think so. And then you get into the ethical issue again, and we're kind of dancing outside of some of the factual claims. I think you need to discuss the advocate's evidence and lack of evidence a little bit more frequently. And for instance, talking about whether or not a right exists, the most basic research would indicate that the Supreme Court has ruled on this and denied that such a right exists, however, that states could grant such rights. So if a state decides to grant the right, that's fine, but there's no constitutional right provided by the U.S. Constitution. You know, that was a court ruling, and it doesn't appear that you found that, and that would have been, I think, a pretty, simple response on that particular point. And you're not chewing gum while you're giving a speech, are you? Yeah, you are. Okay, just double checking.